Now, when word of the military's report broke yesterday, one of the first voices you heard on this network was that of seniors advocate Laura Tamblyn Watts. She's the president and CEO of CanAge, a frequent guest on our program, so we want to carry on the conversation with her this morning. She is in Whistler, British Columbia. Laura, thank you for coming back today on this very important matter. Good morning.
Good morning.
You know, we've had a day to absorb the findings, but it's hard to get over the dismay, Laura, and the disgust, really, at what the military report laid bare.
Yeah, I think that I've seen everything, and then we see another report. And this one struck a chord so deeply with us at CanAge and across the country. Because what it says is, if you've managed to horrify the Canadian military, whose job it is to go into war zones, how bad is the circumstance? And the other question is, what about the other homes where the military is not there, not providing the assistance as well? So it's not just what we see, it's what we haven't seen.
That's exactly right. I mean, Michael was just making that point. These are just 5 homes in Ontario where the military was, and they weren't exactly going about their work in a clandestine manner. Everybody knew what they were doing. So it wasn't a secret probe or a secret whistleblower in that extent. The mind boggles at what the full scope could be. How did we get to this point, Laura?
Well, we have done a combination of things which has kind of led to a perfect storm. We have consistently cut back in things like public health, so vaccines and the types of things to keep people healthy. We have cut back in terms of dollars invested into seniors' care. So we have long-term care homes that are in some cases old, 4 people to a room, shared bathrooms of sort of 20 and plus people bathing together in one shared environment. We have a consistent cutting down of staff, and in some cases for long-term care home, a real question about profits. And all of that squeezes a system so tightly. It was really very difficult before the pandemic came, and now we're just seeing it breaking.
So what you just outlined, people have been crying about for years. Those are not new problems to be exposed. We've known there's a crisis in long-term care for some time. So people have been talking about solutions, too, for some time. They've perhaps fallen on deaf ears, but perhaps now people are far more receptive given the circumstances. So let us spend some time together looking at solutions. I know we could probably talk together about this, your views, for the whole hour. But let's hone in on your top 3 things that need to change right now.
Staffing reform. So we need to make sure that there are staff ratios, that there's staff with better training, and that we pay and treat our staff better. So just get more people better trained and treat them better in long-term care.
Okay, the workforce changes. That's number 1. Number 2.
Infrastructure. So right now in Ontario, we're going to lose about 30,000 out of 76,000 beds in 5 years because they're not even up to fire code. But we need to not just refresh that stock, but we need to invest in smaller, home-like environments which are better in terms of quality control, where people want to live, and better for infection control. So the infrastructure is critical.
Third?
And the infection control in this case is really a key piece. And so that has to do with, yes, personal protective equipment and testing, absolutely. But again, it has to do with things like making sure that the people have the right vaccines so they can stay as healthy as possible, and really wrap it all together with a change away from the medical model and into what we call emotion-focused or transformative long-term care. So it shouldn't be about being in an institution. It should be about being in a home. And if we do that, people are healthier, staff is happier, and infection control is better.
Okay, so as you lay that out, it just makes perfect sense. I'm wondering, who then should oversee this? Tell me about the system of oversight that needs to be in place. Michael was reporting on how the number of inspections, for example, had been reduced in the province of Ontario. What kind of oversight, what quality of oversight, what frequency of oversight do you need?
It's a combination of 2 things. It's important to remember that actually Ontario's long-term care home system is the second most regulated system in Ontario after the nuclear system. So it's not sort of the number of laws or the degree of regulation. It's regulating the wrong things. We need to have a focus on quality as opposed to spending days and days out of the month doing nothing but trying to keep up with these very micro regulations. So a shift on how it's regulated. But having said that, once the quality standards are established, we need to make sure that the inspections are surprise inspections and comprehensive inspections. So this government pulled money back away from the inspections, despite what they're saying. And we've seen that really only 9 comprehensive inspections were done last year. If you know what's coming, you tidy your house. So we need to make sure that they are fully comprehensive, but also on a surprise basis.
So who should oversee? It sounds like the solutions are as well known as the problems by those like you who work within this industry. Who should oversee all of these changes to come, potentially? Is it something that should be apart from government? Could there be some sort of ad hoc committee that could be in charge of reform?
You can create a national standard system like they do in Australia. So I think Ontarians are frankly fed up with provinces and territories each pointing the finger at each other, saying it's somebody else's responsibility. It's the responsibility of all Canadians and all Canadian governments. So the Australian model has a National Standards Council, which has the ability to both check quality and suspend licenses and provide fines. We can do that in Canada. We just actually have to do it. The issues are well known. The solutions aren't that hard. You just need the will to do it.
And again, perhaps this is a moment, which I'll come back to in just in a second. But as I listen to you again, can all of what you're suggesting be done without an independent commission, which is on the books right now, or the full public inquiry that the Premier seems to be more open to now? Or do those need to take place as well?
We do need both. We need a public inquiry, and at CanAge, we're calling for an inquiry which is binding and can compel witnesses, and we need to make sure that there's funding to support advocates and families and residents to participate. We need to know what happened in this circumstance. But how to fix long-term care, we know how to do that. We don't need to wait for an inquiry.
The pandemic has exposed what many have long known. Has it also provided a moment to bring about change that many thought might never come?
We've been, calling into the wind for generations, it feels, in the last, couple of decades in Canada about change in long-term care. And all it's really done is gotten worse. So when Doug Ford says he inherited the problem, that's true. But at the same point, we know the solutions to do it. It really is an investment. It really is different oversight. And it really is an agreement that we're going to make seniors a priority in our funding. We're tired of the sort of thoughts and prayers. We need to see policy and funding.
We may hear more expressions of thoughts and prayers later in this week, though, because the report into what's been happening in Quebec's long-term care homes is yet to come. We expect that within days. What are your expectations of it, Laura?
I think it's going to be some of the same things. I mean, it really, when we're looking at what Quebec was like before the military came in, and I'll draw attention to the Résidence Herron, which was compared to a concentration camp where people were left for days without food and water, I would be astonished. And in Quebec, of course, there were 25 homes where the military went to, as opposed to just 5 in Ontario. So I think that we're getting ready to see more of this. But again, if you can shock our military, if you can see that there are cockroaches and flies, people being left for hours crying out for help, products being hoarded because there's concerns about the cost of them. I mean, these are not new issues, but they are something that I think gives us a moment in time in Canada to really think about, do we need to pivot? And the answer is yes.
Laura Tamblyn Watts, as always, thank you for sharing your experience, your perspective as we look to the future with you today. Thanks, Laura.